my preliminary test for my SOT video. First, I'm going to start with step 1, the distortion analysis. I'm going to have the patient stand straight, looking straight forward. I'm using my thumb. I'm going to put it at the AC joint, checking for A to P sway. Greater than 1/4 of an inch would indicate a category 1. Then I'm going to have the patient turn with their back towards me, putting my thumb at the S2 tubercle, checking for side to side sway, which would be indicative of a category 2. And now I'm just going to assess for an antalgic lean or leaning gait, which would be indicative of a category 3. Step 2 is rib palpation. Using my thumb, I'm going to place it on the T1 posterior tubercles. I'm going to have the patient flex their head forward, extend it backwards, flex it a little slower, just a little slower, go again. Okay, now back, extend it all the way back, okay. I'm feeling for, to see if any rib moves. If one rib moves, if it's a unilateral movement, it's indicative of a category 2. If both tubercles move greater than 1/4 of an inch, it's indicative of a category 1. If neither rib tubercle move at all, it's indicative of a category 3. Step 3 is cervical indicators. I'm going to palpate the cervicals, the spinous process, and the TVPs, feeling for tenderness. Category 1 will be bilateral tenderness of C3. Category 2 would be C4, the left lamina tenderness. Category 3 will correlate with the Lovett brothers, meaning if there's C1 TVP tenderness, it'll correlate with the L5 spinous process tenderness. C2 TVP tenderness will correlate with L4 spinous process tenderness. C3 TVP tenderness will correlate with L3 spinous process tenderness. C4 TVP tenderness will correlate with L2 spinous process tenderness. C5 TVP tenderness will correlate with L1 spinous process tenderness. Step 4 is cervical compaction test. I'm going to place my hand under the patient's head. I'm going to have the patients put their feet together. Put your feet together. Lift your legs 18 to 24 inches off the table. Okay, and you can let them down. Okay, now I'm going to compact the patient's cervical vertebra and ask them to lift their legs 18 to 24 inches. Okay, you can release them. Okay, if the legs got easier with compaction, then it would be indicative of a primary cervical problem, a category 2. I would then go to the second part and do the cervical stair step. I'm going to have the patients put their feet together. Don't lift them this time. And I'm going to feeling for a bulky or restriction. And once I find the restriction, I will adjust it in a figure 8 motion. Okay, and I will do that through the restriction about 4 times. Okay. Step 5, part 1 is basically the balancing flow of the CSF. I'm going to take my fingers, equally spread them out under the EOP and inferior to the nuchal line, and I'm basically feeling the energy, waiting on the popcorn field to flow, waiting on the head to balance.
I know she probably had been doing before I realized somebody was.
And this can take anywhere from seconds to minutes. Okay. Part 2, I will palpate the sagittal suture, feeling for tenderness. Once I find tenderness, I will press and hold as the patient take respiration. So I'm going to press and hold, take a deep breath in and out. Okay, and I will hold it for 3 respirations. Okay, and this is basically preparing the patients for category 1, 2, or 3.
Just like I said, when a person
bringing the patient's hands together. I'm going to have the patient keep their hands together, bringing it straight up, and then bend. I'm looking to see which one is longer. In this case, is the right one. That's indicative of a category 2. So I'll go and do a SOAS analysis test. I'm going to, is it okay if I touch you? Okay. I'm going to have the patient, you can let go. I'm going to have the patient take a deep breath in. Exhale. Okay. I'm going to go, do it again. Deep breath in. Exhale. Okay. And I'm pushing, giving a little more pressure after each exhalation. Okay. Thank you. 7 is the anterior iliofemoral test. I'm going to take the patient's ankle, rotate them in, feeling for restriction. In this case, it is the right. So I'm going to find the greater trochanter, locate the greater trochanter, and just superior and inferior to it. I'm going to pull, and when I pull, I'm going to have you rotate your foot inward. So on the count of 3, 1, 2, 3. 1, 2, 3. I'll do that twice, and on the third time, when you rotate in, I want you to rotate out real quickly. So when I say 1, 2, 3, you're gonna rotate it out that way really fast, okay? 1, 2, 3. Okay, thank you. Step 8 is the arm fossa test, and this is the definitive test for a category 2 subluxation. I'm going to have the patient raise their arm at 90 degrees. Palm in with a soft fist. I'm going to ask the patient to resist as I test for a strong muscle. Okay, the muscle is strong. I'm going to find the ASIS going down the inguinal ligament, touching at the upper right quadrant and the lower right quadrant. Okay, so I'm going to find the ASIS by the inguinal ligament, touching the upper left quadrant. I'm going to have the patient resist. Okay, I'm going to have the patient resist, strong. The left upper quadrant was weak. Okay, you can put your arm down. I'm going to go in a clockwise motion and do this side. Have the patient lift their arm, palm forward, soft fist. I'm going to have you resist. Okay, strong muscle. I'm going to locate the ASIS, just medial to it, finding the right upper quadrant. I'm going to have the patient resist. Okay. Wait. I'm going to have the patient resist. Okay. Going to find the lower right quadrant, have the patient resist. Okay. The patient had a left upper quadrant weakness, which would be indicative of a category 2.